Hi guys, what's up? It's Liv. I thought I would do something a little bit different today than I would normally do. I thought that it would be cool to make a couple videos on my reactions to other videos. And quite honestly, I have a really bad poker face, so I thought this might be funny. So yeah, first part that I'm going to do today is do some reactions to Seizure first aid training videos. I just finished watching The Good Doctor, but like in medical shows, there's a lot of inaccuracies of different like conditions and seizures and stuff like that, and like ICU stuff, and it's kind of hilarious if you work in healthcare. So I thought today I would make a reaction video to seizure first aid training videos and like what to do. So let's jump into it. Today I have 5 videos that I'm going to share, and then I'm probably going to make a series out of this because I have a feeling that this is going to be hilarious. So, without further ado, first one. This is a trigger warning. If you guys cannot take a joke, humor is how I cope. So, click out, swipe up. I don't know. Let's play.
If you see someone having a seizure, don't freak out.
Yo, I swear to God, I've seen my sister Lenya wearing that exact same outfit. That's crazy. She's gonna kill me for saying this too. That used to be the styles, like scrunched up hair, multiple layers, those scarf, the shoes, everything. And also, I remember when I had my braces, I had those elastic bands. Those were horrible. This girl showed up. She was not playing. She was ready for this role. She knew what she was doing, and she said, all right, I'm about to eat. So she's eating.
Journey.
Try to stay calm.
Of course it's true.
Make sure the person is safe by clearing the area around them and rolling them on their side. Don't put anything in their mouth. It is not safe.
Period.
Some people think you can swallow your tongue when you have a seizure.
This is not true. It's impossible to do.
I love my grandparents dearly, but they grew up in a very different generation. And when I had seizures, they genuinely thought you were to put like a wallet or a spoon in your mouth so that you would stop and not choke, which is just like not a thing. Like that's whatever. Next part.
If there is someone nearby, ask him or her to get help while you stay with the person.
Talkie, come quick.
Did she say talking?
If you can, time the seizure with a clock so you can tell someone how long it has lasted. Turn the person on their side if possible and place a soft but firm item under their head, like a jacket.
I will say it's kind of inaccurate because when someone is like, I mean, if it's a convulsive seizure, like someone is so tight that it's really hard to turn them. That's like one thing my mom and my sisters have said, like when I've seized in the past and been like super tight in my seizure, it's really hard because I'm like a sack of potatoes, so.
Thicker items like a pillow don't work as well since they can sometimes cover the person's nose and mouth.
Oh, she just went, yeet.
Try to loosen tight clothing, especially around his or her neck.
Because everyone wears scarves.
Once you've done all these things, stay with the person until the seizure ends.
Are you okay?
Speak calmly to the person when they wake up, since they may be confused or scared and usually don't remember much of what happened. If the person has seizure medicine, get
the little boy, he's just, that's all he does to help.
an adult to give any medication.
Wait, the dad didn't even give
If the seizure does not stop within a couple minutes of that medication dose, it is best to call 911, even if the adult gave medicine.
The number one thing to remember is stay calm and don't freak out.
All right, I like that one. That is very kid friendly. I would show that if I was like presenting at a like middle school or something like that. That would be like one of the videos that I think I would show. Would I use that for adults? Probably not. Does it need to be updated? Yes, for sure. 100% it has to be updated at least a little bit. Had to have been 2000, 2001. I don't know. Hannah Montana era, so that's like 2005, 2006. Anyway, next one. This one has the second most views. I literally just chose the ones that have like the top 5 views, so we're just gonna do that.
So what do you do if you find someone who's having a seizure? Number one, you want to stay calm.
Hi, Mary.
Assess the area, make sure that there's nothing that can cause injury to the person while they're having a seizure. You want to pay attention to the length of the seizure. You want to clear onlookers away. You don't want to clutter up the area with people looking and oogling and awing. You have to be sensitive to the person who's having the seizure as well. Don't put anything in the person's mouth. I know that's an old wives' tale, to put a spoon or a wallet in their mouth. They will not swallow.
I was just saying this. I didn't even watch this either. We're on the same wave, you and me, Mary.
Follow their tongue. They just need to ride out the seizure. You don't need to put anything in their mouth. It can cause more damage to shove something in there. You don't need to hold the person down. That can also cause more damage if you're fighting against them while they're shaking. Afterwards, you want to put them in the recovery position. Roll them over to their side. That way, if they start to vomit or any kind of saliva or any kind of fluids come out, it'll fall and they won't choke. So once they're recovered, you want to help.
That is a really good point to make, because I have seen people choke. I have personally bit my tongue so hard that I was bleeding. So I think that's very important, because it's not to scare anyone, but like, it's realistic. That's something that could actually happen. So
help them up, try to get them in a safe place. It may take them a while to fully get back to their normal self. If the seizure lasts for more than 5 minutes, you want to call 911. If the person suffering the seizure is pregnant or diabetic, you want to call 911. If it happens after a head blow or after ingesting any kind of poison or chemical, you want to call 911. If the person has another seizure within 24 hours, call 911. If the person is epileptic and has seizures often, they will wear a bracelet that says epileptic. This is part of their normal life. Be supportive.
Period. No receipts. So I will say, everything that you said is very factual, very good. Honestly, a very good informational video. Kind of cut, dry, boring, but like, we like it. We're good. She's very demure. You see her eye makeup, her nails. She knew what she was doing today. So, all right. This next one is the third most played, and the thing I don't like about it, I will be honest, is the fact that it says it's from 10 years ago. I'm pretty sure it's like 8 or 10 years ago. So this is another one where they need to be updated. But let's watch. No judgment yet. Oh.
In this video, you will learn to administer first aid to a person suffering a seizure.
Alright, if she keeps cutting the apples like that, she's gonna be, or I think those are apples, she's gonna be needing first aid for cutting herself, because that's dangerous. Oh, that's a nice espresso machine in the background. Oh, what's happening? Oh,
During
and a
the seizure,
sack of potatoes.
Do not try to move them unless they're in danger.
Oh, Grammy's having a heart
Remove
attack
any
for
objects
sure.
around them which may cause harm. Do not restrain their movement.
This right here, I will tell you, this scene right here is what I mean when I say flop a fish. To any of my friends, any of my followers, anyone that, when I say, oh yeah, I flop a fish, or like any epileptic say, this is the example right here. This is the image in my head of like flopping a fish. And you know what?
Movements, but protect them from injury by cushioning them.
Right on.
Do not put anything in their mouth. They will not swallow their tongue. After the seizure, if the patient is unconscious, tilt their head back to ensure that their airways are clear and check their breathing.
I've never seen this before. I've never seen this happen. Like, maybe? I don't think I've ever seen that.
Place them on the side in the recovery position.
That's true. Recovery. Oh! Grammy's dogs are out and they are barking. Oh my god. It's gonna take this poor woman 30 seconds just to. Yep. She's still not. Alright. Literally. Like
Stay with them
30 seconds.
until they have fully regained consciousness. This could take several minutes. Call the emergency services and tell them if the seizure has lasted more than 5 minutes or there have been more than one. The patient is a child. The patient has not regained consciousness. The patient has never had a seizure before.
Oh, this is cutesy. Grammy is tucking her in. That's nice. So yeah, I think it's very true. Like, this is all factual for the most part. Some of it, I don't think I would, like, yeah, I wouldn't do that, actually. I would stay away from opening someone's mouth like that when they're checking their breathing. Pretty, again, straightforward as to video. Yo, I don't remember what one we're on. 3? I don't remember. Are we on 3 or 4? Pretty sure we're on 4. So we're going to do video number 4 now. So let's get playing. And this is called How to Help Someone Who is Having a Seizure. Oh, press play.
Hi everyone, I'm Selena. I'm a registered nurse at Parkview Hospital Randalia in the emergency department, and today we're going to talk to you about what to do if someone has a seizure in public. Anyone can have a seizure. There are a multitude of reasons why someone could have a seizure. One of the reasons could be a low blood sugar, a high fever in an infant, a massive stroke, or a chronic condition called epilepsy. So things to do when...
2 things. First off, love how she brought into the video that there's more than just 1 or 2 things that cause it. I think that it's a misconception that, like, if you have a seizure, you have epilepsy. If you have a seizure, it's because of flashing lights. It's a lot more than that. There's a lot more to it, number 1. And I like that she kind of went through. Second part is, what is her skincare routine? And if she's on TikTok, if she's on YouTube, if she's on Instagram, someone send her a message saying that I'm looking for her skincare routine because I have really bad acne and she has porcelain skin. Hashtag jelly. And this has to have been around 2020 time, like COVID time, because they got masks on. So, relatively new.
someone has a seizure. The first thing you're going to do is protect the person's safety because they're unaware of their surroundings and they're not able to control any of their movements. You do not want to restrain the person while they're having a seizure.
Girl's throwing it back. She's throwing it back.
To yourself and also the person that's having the seizure. Step 2, you want to turn the person to a sideline position because the tongue can obstruct the airway, and so when we turn someone to the side, they're able to have their tongue off to the side of their mouth. It will also allow saliva to run down their face and not into their lungs. Step 3, unlike the myths you may have heard, you do not want to put anything into the person's mouth because it could do more harm than good. Step 4, you want to remove any restrictive items such as glasses or tight clothing around the neck.
Oh my god, I've broken so many pairs of glasses.
Way the person's able to breathe appropriately. Step 5, you want to time the seizure. This is really important. Seizures will typically last between 1 to 3 minutes on their own. If seizures last 5 minutes or longer, then it's likely that they won't stop until interventions have been given by a medical provider.
Super important. You don't need to call an ambulance right away. And that's another thing that's a misconception, is like you always have to call 911, blah, 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 blah. If it's someone that has a history of seizing, please don't, because it's going to be super expensive at the end of the day, and it's something that's like super normal. Again, like she said, if it's 5 minutes more, then yeah, please do us the service and get us some help. But for the most part, you getting dead pretty quick from those ambulance rides. So
Step 6, you want to stay calm in this situation because seizures can look really scary, and you want to reassure the person and the family members around. You want to stay with the person because this person is going to go through a post-ictal stage. They're going to feel tired, they're going to be confused, they may just want to sleep, and this can last minutes up to a couple hours. This person will not remember the event that just happened, and they may also complain of a headache and sore muscles. Just remember.
I 100% agree with this one. I really like this video. This is one of those videos that I would share to anyone that wants to learn more about like seizure first aid or whatever, because it is very, updated for the most part, very updated. It covers everything, the who, what's, where's, why's of how to help in a seizure situation. I don't know. I just like it. Overall, I think this is one of the best ones. It's also pretty short. Staying calm, yes, that is super important. I feel like that's not talked about a lot because everyone gets overwhelmed, as most people do. But that another thing is that people don't really realize that like after a seizure, you're so tight during a seizure, and like convulsive seizures, like you're so tight that your muscles just like lock up, and you're seizing, and you get bad like knots. You're sore, and so like when I was younger, I would have seizures like that. I would have to go and get massages like 2 days after because I'd be so out of it, and then I'd wake up in pain and blah, 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 blah. But anywho, that's a good one. Again, if this girl sees it, please tell me your face care routine. I would love that. Thank you. Last video for tonight. I'm really tired and I want to go to bed. So this is the last video that we're going to watch. This is from Epilepsy Foundation, so I have high hopes for this one. I don't know why I've never seen this. And also, side note, not to plug Epilepsy Foundation, this is not in any way like sponsored or anything like that. But if you guys do want to get first aid certified for seizure first aid, Epilepsy Foundation has like a free program that you can do. It's super easy. Literally takes only a couple hours, and you can do it online. There's I'm pretty sure there's in-person ones, but in certain places. But it's very fast. I have mine. Highly recommend. You never know, because you don't even have to have epilepsy to have seizures. Let's watch the video. Hashtag stay safe. Hi, Michael. You got it. Nope. Potatoes. Like a sack of potatoes. Oh, this is a good one.
Guys, give us some room. He's having a seizure. Give me some towels. Okay. Stay calm. It's gonna be fine. Help me get him on his side.
Honestly, everyone's acting in this pretty superior. Honestly, good job.
All right, listen up, fellas. Before we practice, I want to go over a couple of things. First, I'd like to welcome back Michael.
Okay, Michael.
Good to have you back. We all know Michael has epilepsy, and he shared his seizure with us in the game.
He got epilepsy. My friends and I have an inside joke because one of my friends couldn't say epilepsy, and she said epilepsy. Epilepsy. So now it's like our group chat name.
He has something he wants to say.
Not that anyone really wanted to know that, but
thank
I
you
thought it
all
was
for
funny.
supporting me, and thanks to Coach for knowing what to do. I'm sorry if my seizure scared you guys. It could be scary for me too. But what's even more scary is if people didn't know what to do.
So today...
Why does he look...
He plays high school basketball and this man looks 35, 40 years old.
What the heck?
And then the guy right here, this guy looks 16. This guy, 35 and up. And up, that's being generous.
We are going to learn seizure first aid thanks to the Epilepsy Foundation.
Oh.
We're teammates, right? We take care of one another, we count on one another, and when anyone with epilepsy has a seizure in front of you, they're your teammate, and they're counting on you. So, first, stay with him, okay? Stay calm, and keep others around you calm and out of the way. Protect him, keep him safe. It's also important to remember that the person having the seizure should be lying down, and that there is nothing harmful in their way. Turn them on their side and support their head so that they're not banging it, or so they don't choke. Never put anything in their mouths, and do not hold them down. Time the seizure till the very end. Okay? Knowing how long the seizure lasts is important information for the doctors to know. If the seizure lasts more than 5 minutes, call 911. When you see somebody having a seizure, you're going to feel a little powerless. But if you protect
Give this
them,
guy an Oscar.
and if you stick with them
he's
by
selling
their
it.
side, you're doing the right thing.
He really seems like a coach to me.
Okay? All right, let's practice this.
Bulldogs on 3. 1, 2, 3.
Bulldog! Wonder why Bulldog? Oh, that's embarrassing. He really thought he was doing something there. I think that this one's really accurate. I'm biased because I love the Epilepsy Foundation. They've done a lot for me throughout my journey. That video is great. Again, I am going to plug it in there that you can get seizure first aid certified on the Epilepsy Foundation website super easily. I'm pretty sure you can probably get those printouts. So if you are in like a school, you want to put one in your classroom, it's really important to teach as many people as you can about it, because you know you never know who's going to have a seizure. It could happen to anyone, like they said in previous videos. So anyone from young kids to adults, it's something that I think a lot of people should start teaching people young. So it's kind of out there and bring awareness to it, because again, it is a pretty serious situation, and it's not really talked a lot or trained a lot. So highly recommend. Hope you guys enjoyed this reaction video. If you guys want me to react to other TV show clips, video, movie clips, anything like that, DM me them, comment them below, something like that, and I'll try my best to make a video, because I'm actually having so much fun with these reactions. So yeah, stay tuned, follow for more. Thanks. Bye.